Let's make sure it's recording too. Yes.
I see the light. Yeah.
I see the light. Hi, everybody. I am Joy Rosa with Earthworks Acupuncture, and I am currently located on Chinook land, also known as Multnomah County, and also known as Portland, Oregon. So I am first generation of Afro-Honduran descent, and my lineages and roots are from Maya Chorti, Garifuna, and Taino of Central and South Americas. And we're here today with my special guest, Kendra Sims, researcher and educator who crafts data-driven narratives to improve population health. So welcome, Kendra.
All right, thank you so much, Joy. Yes, as said, I'm Kendra Sims. I'm a PhD candidate at Oregon State University in public health with a concentration in epidemiology. I'm also currently in Portland, and I am of African American descent and originally from South Carolina.
Awesome. So can we start by saying what exactly is epidemiology for folks who are hearing this for the first time?
It's a great question because I get things from, do you study bugs? Do you study the skin? But we're really epidemic. It's the study of disease or health conditions, especially among large groups of people. So while your doctor might be focusing on an individual patient, I'm looking at the information from a study or from a state or a town or a hospital and drawing conclusions based on those large numbers, looking for patterns especially.
Awesome. And also to define just a few more things for folks, could you talk a little about what healthcare disparities are and why they're important in particular for Black, Indigenous, and people of color, BIPOC people, to research this?
Sure, I'll focus on, say, what I'm doing in my dissertation now. So I study high blood pressure, hypertension, and it seems, especially in America, that African Americans and people of who are of low socioeconomic or income earners just seem to be diagnosed sooner, earlier in age, and that they go on to have much worse health outcomes as a result, because of high blood pressure, you might have a greater chance of getting heart disease, stroke, some forms of blindness. And so it's this really preventable form of disability, and big groups of people, especially of color, are just getting it more often. So right. I'm trying to understand why.
And this is like a pattern-based thing.
Yes, right? Yes, yeah. It's happening consistently, and so we're trying to look using information like, why is this happening? And because it does seem to be happening systematically.
Yes, and I really love that too, because I have a master's in acupuncture and Chinese medicine and East Asian lineages, and I also am accustomed to looking at patterns in terms of differentiation, diagnostics, and treatments of diseases based on the elements, the 5 elements in Chinese medicine. So those are certain ways in which I believe that this is crossing over into this new world that we're birthing in terms of medicine and health literacy. So I think that that's really important for people, especially people who are tuning into this channel, because it's not so often that we get real live researchers, talking about their real live research about real issues that people are having and people who look just like you and I are having. So why is this research important to you personally?
I guess just from growing up in the South, I had a lot of people who had chronic conditions, and high blood pressure usually doesn't have any symptoms at first. And so you eat all that good Southern food, and out of the blue, was like, I had this heart attack, or now I have the sugar, or now I'm
diabetic.
Yeah, but they think that that's just something that happens. That everybody has high blood pressure.
And family, but why?
Yeah.
Right.
Yeah, but why? And it does not seem to be because of genetics, or it doesn't seem to be strictly because of just eating a lot of good foods or not exercising enough.
Right.
So that was from my personal experience. And then I used to arrange transportation for people with disabilities in Boston, and was noticing again that people of color, people who lived in the inner cities, they would come in their 50s in wheelchairs, and they would have had, major heart attacks and bypasses, before they were able to retire. Whereas people from the suburbs, very affluent people, would come skipping in, but they were, they just weren't able to drive because and now they were in their 90s and their husbands are dying, and they were finding themselves for the first time in their lives, with some kind of loss of independence. So that gap is really what I'm trying to close.
Yes, and I really love that. And also you're working towards your PhD in public health, but you have a master's in public health and epidemiology, as well as a BA in English and psychology. So I just feel like you're really dynamic. Your credentials are beyond impressive. I mean, you're a Black woman in the upper echelon of academia. So, why was becoming an epidemiologist important to you?
It's really to unlock, kind of address those questions, or people, I should not be an outlier. I should not be someone who's out there getting advanced degrees, but I do think it's important for those who are both underrepresented in academia, as well as those who are overrepresented in like poor health outcomes. They need a voice, and I'm doing my best to be that voice.
Yes, you are. And I just love having you again on this channel, because I feel like at this time, especially in terms of mandated restrictions, social distancing, isolation and quarantine, especially our youth are on YouTube and, looking up, not only music videos, but also educational videos. And so I really feel like it's very important for you as well as myself to be here and be the lighthouse for young folks out there.
Yep.
So how has current research on COVID-19 helped or hindered dispelling like panic and misinformation?
I will say that since we don't know a lot, that there is all of this, uncertainty, you know, I would say that the CDC is doing its best, but you can't like rush research. So until we have, systematic testing of coronavirus, we don't know much about how many people even have it. What we do know is that, it's a virus that's, spread through skin to skin contact, and, maybe, yeah, or, touching contaminated surfaces. And that people might be walking around at first not really aware that they're even sick or contagious. And even if they don't have symptoms, they could be spreading this to other people who might be more at risk, say older adults or people with existing health conditions.
Right.
So that's what we're supposed to be getting at: social distancing, limiting the amount of people who are sick at one time.
Right. And you are not like an epidemic specialist.
Right. No, I definitely study chronic disease, so I am quoting the experts and focusing on that as my source of information. And yeah, yeah,
Awesome.
yeah.
And so, yeah, just to kind of talk a little bit about, health is a human right. And,
Right.
It's often systematically denied to large groups. And as we were defining, healthcare disparities in very specific racial and ethnic and socioeconomic status populations that are deemed as, usually usually denied this access to care. And at a very disproportionate rate, we see the development of these kinds of diseases and also the exacerbation of these diseases. And so, right, talking about just, really wanting to dispel panic and misinformation, um, you know, especially to these vulnerable and marginalized populations, like, what efforts can be made, or what efforts have you seen be made within community like TriMet, which is our transit system here in Portland, Oregon, or grocery stores? Can you talk a little bit about
Sure. I would say that some grocery stores are taking that nice first step of having reserved hours for older adults to just go, and only they will go in. A whole store, store that a chain that I won't name, but is already limiting the number of people who can go in at one time. And so when people leave, they'll let you in. Um, and I think those are key measures. Also, just so people aren't hoarding as a kind of response to the panic. They're limiting the amount of say groceries you can get. You know, it's not trying to cut people off, but it's so that affluent people aren't buying up
Right.
all the stores produce or food, and then people who might be on food stamps
Yes.
just can't buy it because by the time they go in, there's no food there.
Right. And speaking again on the experiences of discrimination, and you know, it's a time right now to be able to widen your circle of compassion. So this is not just about, we are now literally seeing this in our face. Your individual health affects your community. And that also goes insofar as, right, shopping for only what you need, and pertaining to things that only fit within your means and your need, and not anything in excess. And I really also want to talk a little bit about the definitions within research between causation and correlation.
Sure,
Kind of a switch in gears, but um,
sure.
right, in terms of just kind of getting back to what you do in epidemiology. What's the difference for people? Can you break that down in a simple way?
Yeah. Let's start with a well-known example. So, like after the World Wars, soldiers were sent home, and they were given a lot of cigarettes as kind of like a prize or reward. And they were noticing that these people were developing lung cancer. Um, and it took years and a lot of pushback from the cigarette industry, but it seemed that with smoking being a cause, the effect was the development of lung cancer
Mhm.
and various cancers. So that would be an example of cause, smoking, and effect, lung cancer. Whereas causation, I do work looking at, say, discrimination's effect on health.
Mhm.
It's a little, it's there's so much complexity going on between something like racism as a cause of say, disability,
Mhm.
because you have to tease apart, and that's why I use statistics among large groups of people to tease apart what is it consistent and is it meaningfully different, um, the way people are treated, and does that lead to, say, hypertension?
Yeah.
Yeah.
Yeah, I think that's important to understand the experiences of discrimination, that can also simultaneously produce this stress
Yes.
within these demographics, especially when we're talking about limited access to individual and societal resources.
Right. And so we have to, isolate, is it how people are treated? Is it how they're coping with how they're treated? Are they, relying on comfort foods? Are they unable to exercise? I also study, say, is it being harassed on the street? Or is that how we're defining racism? Or is it more systemic things like being not able to work certain places or not being to live in certain places?
Right.
So it's just very complicated. So that's why I want the evidence against as racism as a cause of poor health to be as strong as the evidence against smoking as a cause of poor health.
Yes, because we're seeing that in real time right now too.
Yeah.
So, this is very evidence based. um, yeah. Can you talk a little bit about, in response to the pandemic of COVID-19, um, if and how your research has been affected?
I would say that since I did a lot of things remotely and all my data has been collected, I would say that it's not my research has changed, it's everything around it. So at my institution, we're all scrambling to switch to teaching online or meeting online. We also have to navigate social distancing, and if we have children, it's all those balls in the air. But I would say that my research, thankfully, hasn't been affected. But I know people who are in labs and they have sample collection, or they went out and did surveys before. Now their research might be more on hold because that primary data collection, especially, is now kind of not happening.
Okay.
Yeah.
And while you're doing this research, especially in this time of uncertainty, I would like to know, in what ways does a researcher like yourself, an epidemiologist like yourself, provide care for yourself during this time?
I personally, you mentioned before how we've met. We used to meet at coffee shops, and that used to be my big outing and how I used to work. But now I need to impose that own structure and my own working environments. That meant cleaning my room. It meant putting together a standing desk out of various books and things. It means going out for runs or walks. It's beautiful out, so it's because if I don't take care of myself, I can't get my work done. So those are how I'm practicing self-care.
I think that's really important. Number one, to practice self-care, because number two, you want to continue doing what you love doing. Some of us are very research minded. Some of us, are musicians and artists and creatives. And so this is a time where uh, I want to help flip the narrative of fear and uncertainty into the ways in which we root into ourselves and really find a place of calm collectedness, even amidst a very large storm. Because the work still, I don't want to talk in terms of like productivity as my self-worth, right? But I do believe that this is something that you care about very passionately about. And it is also helping other people along the way. So being able to take care and provide for yourself, especially during uneasy times, is the time that you really do need to hunker in on that the most.
Oh yeah, because if I can't help myself, I can't do my work and I can't benefit others. So.
You cannot, gift from an empty cup, so to
Right.
speak. So, yeah. So, what advice would you give any kind of fellow researcher or epidemiologist regarding pandemics or the study of pandemics, or um, any thoughts on
Yeah, really just, stick to the sources of information that are reliable, the CDC, the Centers for Disease Control, the World Health Organizations, because they are providing, consistent, up-to-date information. It's not clouded by, people's fear. Even when we don't know things, there are definitely certain things we do know about how to protect ourselves, or why we're social distancing, why we need to practice hygiene. Even if you are feel healthy as a horse and don't think you're at risk, just think of your grandmother.
right?
Think of that neighbor or community member who might not have your immune system.
Yeah.
That's who we're doing it for.
Also, call your grandmother.
Yeah, call her. Just call her and see how she's doing. If she's in town, maybe if you're after practicing some, hygiene, and maybe offer to get her groceries. My grandmother told me that she went to 7 different stores to find toilet paper recently, and I'm like, this is silly. So
What's
but
Carolina?
yeah, this is South Carolina. So she drove to 7 different places in South Carolina, and she was like, "Baby, I don't know what's going on out there." I'm like, "Well,
I know. I'm also from the South, and
yeah,
North Carolina, and I claim both Carolinas. So North Carolina, I have not heard as many reports as I have of what like the South Carolina governors are suggesting and doing. when you live in the South too, you're very used to episodes like this, like in terms of like when hurricane season hits, like
Yeah.
this is kind of the norm when you're coming from the South, but this is at a much larger scale, and this is affecting everybody. And so precautions are absolutely necessary. Please, even if you do not see, this happening, believe, like, what's been the most alarming for me is the lack of understanding and education on not only health and how to take care of oneself,
Mhm.
but also what actually is a viral pandemic. What is a virus? What does this look like? And really, what precautions should I be taking? I was at a local grocer up the street from me the other day looking for the last bag of cat food for Sid.
Right,
And
right.
um, it was because Amazon had run out actually of cat food. So I decided to go out, and I've actually been self-quarantining. Full disclosure, I've been self-quarantining since last Friday because my gym actually had a positive case. An integrative center that I had been attending had a positive case. And in the interim of receiving my license to be a licensed acupuncturist, I've been doing Lyft. And so those have had positive cases too. And when I was at the grocery store, I thought, this is not one of those grocery stores that is implementing like 8 to 10 people at a time. This is a grocery store that's allowing any and everybody to come in. There is no social distancing practice or technique enforced. And the only lines that were open and available were the self-checkout lines, and there were no hand sanitizer stations, there were no gloves. I mean, masks are not really available here right now. So it was really quite alarming to me. And that's, again, another one of the impetus for creating this channel, is to really share how to help protect oneself during a time like this. And again, social distancing and these kinds of self quarantines or issued quarantines or isolation are very, very much a standard in care. We saw even the epicenter of Wuhan, China, they don't have any active cases anymore. And now they're going um, to Italy to help. And they've integrated also Western and Eastern medicine. But, they had laws and they practiced them accordingly. So that's part of the hope of this channel, is to provide hope, but also care.
I would just say that know that the measures that have been advised in America are based on these other countries' examples, good and bad. So while China really did its best to clamp down, Italy didn't so much at first, and they just continued to go business as usual. And then they went on to have a higher fatality rate than China did.
Right.
So it's about being proactive. It's about, let's try to minimize the damage, limit our exposure, because it's for the greater good.
Definitely. Yes. This is how I enjoy providing and promoting wellness in the area,
Right.
in talk stories, conversations like this. So uh, just to kind of start wrapping up, if you could reach more people to discuss what you're providing for yourself and the community in terms of research, would you do that? And what would that look?
Sure. I have a website. It's Kendra Sims, KendraSims.com. And I'm actually planning on having a Spotify playlist of podcasts where I got a lot of my updates and information, because it's kind of fair and balanced. And it's a way to just have a nice voice in your ear, feel like you're part of, in the loop and engaging with someone. So that'll be on my website. So I hope people check that out.
Awesome. Yes, we will definitely link all of your information to this video, especially when I upload it onto YouTube. And lastly, would you be open to more Zoom chat conferences or webinars about different topics in research or epidemiology or studies of diseases?
Sure, it's really great to be able to share my research, and it's kind of isolating a little bit, and so it's good to have these outlets. So I hope this can continue.
Yeah, and I do. I really admire your work and what you're doing, and I really commend you for coming on here with me today and beginning the process of making all of this information more and more accessible to people. You know, because right now, I mean, again, we have people who are um, you know, they have their children home at school and from school, or you know, they just need a place to, you know, not only like look up, you know, cool music videos, but also to see faces like us, you know, and talking about, you know, really cool research that you can do, and ways that you can navigate such a strange time.
Yeah, definitely. Health is wealth and health is knowledge. So, any way I can contribute that is, I'm all about it.
Yes, I love
Yeah.
it. Well, thank you again so much for being on here. We'll link all of your stuff in the description box on YouTube, and we will definitely be making more videos and conferences and webinars with you in the near future.
All right. Thanks so much, Joy.
Thanks, Kendra.